It's midnight, your bedroom is quiet, and your throat won't stop tickling. You turn to the left, then to the right, sip a little water, and the cough still comes back in waves that keep you from falling asleep. If that's been your night lately, give me the next 24 hours. 7 gentle teas, used the right way and at the right times, can soothe your throat, calm the urge to cough, and help you rest. The trick that almost no one over 60 is told is that the mode of preparation and the timing of the cup matter more than the specific plant on the label. You don't need exotic ingredients or complicated gadgets. You need warm hydration space through the day, herbs that coat or open the right parts of your airways, and a bedtime routine that tells your nervous system it's safe to settle. I'll walk you through a fast, safe, doctor-aligned protocol you can layer onto the treatment your clinician already recommended. Try 1 cup in the morning, 1 in the afternoon, and 1 60 to 90 minutes before bed, and when you wake up tomorrow, jot down how your night went. You'll have proof that your body responds when you give it steady care. Before we brew anything, it helps to understand why coughs seem so stubborn after 50. The air in our homes is often drier than we realize, especially when heaters or air conditioners run. Dry air shrinks moisture from the lining of your throat and nose, making the tissue more sensitive and easy to irritate. Allergies are another culprit. Post-nasal drip slides down the back of the throat and triggers that constant urge to clear it. Reflux shows up quietly in many adults over 50, especially at night. Stomach acid or even just digestive enzymes creep upward, the throat gets irritated, and the cough reflex switches on just as you lie down. Simple infections and lingering irritation from talking a lot, singing at a family gathering, or even cheering at a grandkids game can keep the throat raw for days. A medication category called ACE inhibitors, captopril and similar drugs, can cause a dry, nagging cough in some people. If your cough started right after one of those medications, make a note and bring it to your doctor because a switch sometimes solves the problem. Teas won't cure a lung infection or replace antibiotics when they're truly needed, and they won't change your prescriptions. What they do is hydrate the tissue, loosen thick mucus when that's the issue, gently coat and protect a raw throat when dryness is the problem, and relax the tightness that makes you cough more when you're tired. They are functional relief with a purpose. Let's set a clear, simple rhythm for the next day so you get the most from every sip. You'll have 3 key tea moments: morning, afternoon, and about an hour to an hour and a half before bed. Each time, pour yourself a modest cup, 200 to 250 milliliters. Keep sugar out of the mug. Sweeteners can inflame a sensitive throat, and for those with diabetes or prediabetes, they shift blood sugar right when you want calm. If you enjoy a little aroma without sugar, use a strip of orange peel, a slice of lemon, or a short cinnamon stick as long as reflux doesn't bother you. While your tea steeps, breathe slowly through your nose. The warmth you inhale humidifies the nasal passages and the back of your throat. The environment around you matters too. Add moisture to your bedroom for 20 to 30 minutes with a humidifier if you have one, or place a shallow bowl of water near a heat source to lift ambient humidity. Raise the head of your bed by a few inches with blocks or a wedge if reflux is part of your story. And avoid cold air blowing directly at your face. A fan on low across the room is fine, but a cold jet at your mouth and nose is a recipe for an all-night tickle. Now, 7 teas. I'll show you what each one does, how to prepare it, when to use it, and how to keep it safe with the medications and conditions that are common after 60. You don't need to memorize everything now. Pick the two that fit your day best, and the rest will be here when you want to rotate. Start the day with thyme, the humble kitchen herb that pulls double duty for coughs. A warm cup made from Thymus vulgaris has a pleasant, savory aroma and offers gentle antiseptic and expectorant support. In plain language, it can help loosen sticky mucus and make each cough more productive, so you cough less overall. To prepare, use about 1 tablespoon of dried leaves or a well-filled teaspoon if the pieces are small, in 250 milliliters of hot water just off the boil. Cover the cup, let it infuse for 8 to 10 minutes, then strain well so no rough bits scratch a tender throat. Sip slowly. Morning and early afternoon are the best times for thyme because you want any loosened mucus to move while you're upright and active. If your blood pressure tends to run quite low and you feel lightheaded easily, start with a milder cup and see how you respond. As always, if a plan is new to you, look and listen for signs of sensitivity in the first day you try it. When your throat feels inflamed from too much talking or a day of errands, ginger with a whisper of lemon can be a comfort. Ginger lends warmth and a feeling of better circulation right where you need it and offers mild anti-inflammatory support. Slice 3 to 5 thin coins of fresh ginger, pour in hot water, and let it sit covered for 8 to 10 minutes. If you enjoy lemon and reflux isn't active for you, squeeze a few drops into the cup after it cools a little. This tea shines in the afternoon or after a long phone call when your voice is tired. If you take blood thinners, culinary amounts of ginger tea are typically gentle, but consistency and caution are your friends. Keep the cup modest, notice how you feel, and never mix large amounts with anticoagulant medications without your clinician's knowledge. If reflux visits you at night, keep ginger earlier in the day or make the cup lighter. The goal is comfort, not a zippy stomach at bedtime. If your cough is dry, scratchy, and unproductive, like someone is brushing sandpaper over your throat, the teas you want are demulcents, which means they coat and protect. Mallow and marshmallow root, Malva sylvestris and Althea officinalis, create a soothing slip that lines the irritated tissues so the urge to cough quiets down. You can prepare them hot or as a cold soak, both work. For a warm cup, infuse for about 10 minutes, strain well, and sip. For an even silkier result, place a teaspoon or 2 of the dried herb in cool water and let it sit for 2 to 4 hours. Then strain thoroughly. The liquid will feel thicker, almost like a gentle syrup, and that's exactly what dry throats love. Use this one in the evening when the air is driest and the cough most irritating. Separate demulcent teas from your medications by at least 2 hours. That slippery layer can slow the absorption of pills, and you want your medicine to do its job on time. When your nose is blocked and you feel like you can't draw a full breath through the upper airways, peppermint can create the sensation of open passages and reduce that constant throat clearing that comes from post-nasal drip. A cup from Mentha piperita is easy. A standard tea bag or a tablespoon of dried leaves in 250 milliliters of hot water, covered for 5 to 7 minutes. Breathe in the steam through your nose gently as it steeps. Peppermint is best used during the day, not right before bed if reflux or a hiatal hernia is part of your history. The relaxing effect on the lower esophageal sphincter can make reflux worse for some people, so you'll keep peppermint earlier and choose other teas at night if reflux is your frequent guest. Sage has been used for centuries to settle sore throats and calm inflammation, and it has a special second use when you pair the cup with a gentle gargle. Prepare a mild tea with about a teaspoon of dried Salvia officinalis in 200 milliliters of hot water. Cover and let it rest for 5 to 7 minutes. When it is warm, not hot, take small sips and let the liquid sit a moment on the back of your tongue and throat before swallowing. After a few sips, use a mouthful to gargle for 20 to 30 seconds, tilting your head slightly so the liquid bathes the back of the throat without choking. Spit that part out and return to sipping. The dual approach soothes the tissue directly where it hurts and gives you the whole cup benefit. Keep sage tea moderate if you live with kidney disease or a seizure disorder, and skip concentrated doses. You're after comfort, not a strong medicinal punch. There is a traditional South American ally called guaco, Myconium glomerata, used as a gentle bronchodilator and cough calmed in many households. If your cough is chesty with a little wheeze and you want a plant that seems to help air move more freely, guaco is the one to try during the day. Prepare a mild cup using about a tablespoon of dried leaves in 250 milliliters of hot water, steep for 5 to 7 minutes, then strain very well. Notice your body's response. Some people feel their chest ease. Be respectful of this plant if you take anticoagulants such as warfarin or if your platelets are low. Guaco can have blood-thinning effects and is not a good match with those conditions. Use it thoughtfully and ask your clinician before making it a habit if you have liver problems. It's meant to be part of a daytime rotation, not a nightly staple. For the final act of the day, when you're most vulnerable to that cough, insomnia spiral, linden blossoms are a gentle night companion. Tilia, often called linden or lime blossom, relaxes the body and the cough reflex just enough to help you break the cycle. Prepare a cup with a tea bag or a tablespoon of dried blossoms in 200 to 250 milliliters of hot water, covered for 5 to 8 minutes. Sip this 160 to 90 minutes before bed, not with your head on the pillow. If you take sedatives or sleep medications, linden can make you a little sleepier, which is the point at bedtime, but you'll stick to one modest cup and avoid combining it with alcohol. If you take strong diuretics and often wake to urinate, keep the cup closer to 90 minutes before lights out and make sure your last bathroom trip happens right before bed. You now have a lineup of 7 teas with a clear purpose. The way you brew them will make or break your results. Always cover the cup while it steeps to keep the soothing oils and vapors from drifting away. Strain demulcent herbs particularly well so the liquid is smooth. Keep the portion small. This is not about chugging a big mug that sends you to the bathroom all night. Think one modest cup, 3 times a day. Consider the temperature of the cup as part of the treatment. Warm to hot for loosening mucus in the morning, warm for calming and coating at bedtime. The ritual around your tea matters too. Sit down, lower your shoulders, put your phone away, and let the cup be the center of your attention for 5 quiet minutes. Your nervous system is listening. A calm brain coughs less. There are a few small, fast add-ons that make the day go easier. A warm saltwater gargle 2 or 3 times a day can reduce throat irritation and help draw fluid into the tissue so it feels less raw. Mix a pinch of salt in a glass of warm water, swish and gargle, then spit it out. 1 teaspoon of honey, taken straight off the spoon before bed, can settle a simple nighttime cough for many adults who are not living with diabetes. If you do have diabetes or prediabetes, skip the honey and choose a demulcent tea or a sugar-free lozenge instead. Gentle steam inhalation with plain hot water for 5 minutes can soften thick secretions without any additives. Sit at a table, place the bowl carefully, drape a light towel loosely, keep your eyes closed, and breathe the warm vapor slowly. Never ingest essential oils and never add them to tea. They are potent and not meant for the stomach. Keep the air in your room neutral and warm, not perfumed. As evening approaches, there are a few traps that can undo a good day's work. Avoid caffeinated teas like black, green, and yerba mate in the late afternoon and evening. They wake the brain, dry the throat for some people, and can make reflux worse at night. Skip iced drinks as bedtime nears. Cold constricts and can make a sensitive throat cough on contact. Avoid alcohol as a nightcap. It may feel warm going down, but alcohol dehydrates, relaxes the airway in ways that can worsen snoring and cough, and fragments sleep so you feel worse in the morning. Leave essential oils out of your cup entirely and be cautious with over-the-counter syrups that hide large amounts of sugar in a thick liquid. Your throat may feel briefly slick, but the sugar crash, the reflux, and the night waking are not worth it. Let's turn these ideas into a clear, simple 24-hour example so you can start now. In the morning, brew time. While it steeps, take a warm shower and let the steam bathe your face. Run the humidifier or otherwise moisten the air in your living room for 20 minutes while you sit with the cup and breathe slowly. The goal is to loosen anything that needs to move while you're awake. Around mid-afternoon, when voices are tired and the day's dust has done its work, make ginger with a squeeze of lemon if you tolerate it, then give your voice a compassionate break for 10 minutes. Let silence reset your cough reflex. If your nose is stuffy, rinse with a gentle saline wash or use a saline spray and feel how peppermint earlier in the day and the rinse now reduce post-nasal drip. About 90 minutes before bed, prepare mallow or marshmallow root if your cough is dry and irritating, or linden if your cough is part of a restless night. Sip slowly, then do a warm gargle with sage, letting the liquid kiss the back of your throat before you spit it out. Raise the head of your bed or use a wedge, keep your room air comfortably moist, and lean on side sleeping rather than flat on your back if reflux is part of your story. The order is simple: loosen early, rest the voice in the afternoon, coat and calm at night. Safety deserves your attention. Seek medical care urgently if a cough comes with persistent high fever, chest pain, bluish lips, shortness of breath, confusion, coughing blood, new swelling in your legs, or if the cough lasts longer than 3 weeks despite home care. If your cough appeared shortly after starting an ACE inhibitor like captopril, enalapril, or lisinopril, write down the date and talk to your doctor. Many people find relief when switched to a different medication class. If you take anticoagulants, diuretics, or sedatives, choose your teas with intention and keep your clinician in the loop. If you manage diabetes, keep honey off the bedtime menu and avoid sugary syrups. None of these cups replace your prescribed medication. They support healing, keep the throat comfortable, and help you sleep while the underlying cause is being treated. There's something powerful about seeing the pattern on paper, so keep a tiny notebook for 3 to 5 days. In the morning, write which tea you used, how you slept, and how your throat feels on waking. After the afternoon cup, jot down whether your voice and cough calmed. After the nighttime cup, note what time you drank it and whether you used a saline gargle or steam. In the morning, tally your night, how many coughing bursts woke you, how quickly they settled, and how your energy feels. Within 2 or 3 days, you'll see which daytime tea loosens without overstimulating you and which bedtime tea reduces the cough enough to sleep. Pick 2 starters, one for day and one for night, and use them for 3 to 5 days consistently to give your body a fair trial. Because real life includes special cases, Here are a few adjustments you can make without turning your kitchen into a pharmacy. If your cough feels tight but you also notice reflux after dinner, move peppermint to the afternoon, keep ginger earlier and gentler, and choose demulcents or linden at night while you elevate the head of your bed. If your cough is productive and you feel gunky in the chest, combine time in the morning with a warm shower and a short walk. Movement helps expectoration as much as any cup. If your nose is the main driver and the drip won't quit, pair peppermint earlier in the day with saline rinses and keep your bedroom as dust-free as possible. If your throat is simply raw and air hurts to breathe, make mallow or marshmallow root your evening ritual and add the sage gargle. Then protect your room air from fans and drafts. You may be wondering how much better you can feel by tomorrow. For many people, the very first night with a demulcent tea and a sage gargle is quieter. The cough doesn't vanish, but the spikes soften and the stretches of sleep lengthen. The next day, starting with time and keeping your voice off duty for a few minutes in the afternoon lowers the number of coughing fits. By the second or third night, most people find they need fewer rescue cough drops, and the urge to cough calms down instead of escalating into a fit. Your own notes will tell the story. You'll see the difference between a day you sipped at the right times and a day you forgot and tried to make up for it with one big cup late at night. Let's imagine your next 24 hours so it feels real. It's morning and your first cough sends a dull ache across the top of your chest. You fill the kettle, drop thyme into your mug, and cover it. The steam smells like a walk through a garden after a light rain. You sip, take a warm shower, and feel your breath ease a little as you go. You run moisture in the room while you read the paper. By mid-afternoon, your voice is rough from a long call with a family member. You make ginger tea, focus on slow nasal breathing as it steeps, and give your voice a 10-minute break. Your cough de-escalates instead of ramping up. Evening arrives, and you choose mallow because the air is dry today and your cough is more bark than rattle. You infuse, strain carefully, and feel the first mouthful coat the raw places. You take your time with a sage gargle, then set your pillows on a wedge. The room hums softly with the humidifier. When the tickle comes, it passes like a wave instead of a storm. You sleep in longer stretches, and the morning is less of a battle. There's an art to keeping this routine easy enough to repeat. Place the herbs you use most often in small jars by the kettle with a spoon that measures your go-to amount. Keep a timer nearby so you don't oversteep peppermint or understeep thyme. Put your favorite mug where you see it. Leave a note on your nightstand that says cup, gargle, wedge, so you remember even on tired nights. These tiny helps are what make a routine stick, and a routine is what turns a good night into a better week. By now, you know the heart of this method. You hydrate, you loosen, you coat, and you calm. You use time to help move what needs to move, ginger to warm and comfort when you've used your voice, mallow or marshmallow root to protect a dry, irritated throat, peppermint to feel your airways open during the day if your stomach tolerates it, sage to soothe and to gargle where it hurts, guaco as a traditional daytime friend when the chest is tight and your clinician says it's safe, and linden to break the cough, insomnia loop at night. You keep sugar out of your mug, you avoid alcohol and caffeine late in the day, you protect the air you breathe, and you give your body a steady rhythm to follow. Coughs are exhausting, but they are also responsive when you give them what they need. Hydrate the tissue, calm the reflex, protect the raw places, and prevent the triggers that keep the cycle going. Keep your expectations honest. You're not waving a magic wand. You're creating the conditions for your throat and airways to rest so the underlying cause can heal. In 3 to 5 days, you'll have your personal day-night pair of teas that give you the best sleep and the most comfortable mornings. Write their names on a sticky note and make them your starters whenever cough season comes around. If leg cramps have also been disrupting your nights, you can coordinate your routines so the whole body settles at once. For that, there's a companion video ready for you now. If you want to calm your calves while you calm your cough, watch Top 5 Teas that stop painful leg cramps. It will help you choose the right cup for your muscles, the way this one helps you choose the right cup for your throat. For tonight, choose 2 teas to be your anchors. One for the day and one for the evening. Brew them with care, breathe while they steep, protect your room air, and let your throat feel what it has needed all along. Steady warmth, soft protection, and a gentle signal that it's safe to rest.